Mr. Vice President, glad you're with us. First question, did you do it? This morning, how many votes do you have, and how many Republicans do you have joining in to vote for health care reform?
I think the president did do it. He recentered the debate. He laid out precisely why we need health reform, how he'd go about doing it, pointed out that 85% of what he suggested the Congress has already agreed on. So I think, and he debunked the ridiculous assertions about death panels and how we're going to insure illegal aliens, et cetera, undocumented aliens. So I think he recentered the debate here. And he also
did he get the
Republicans?
Said, how many?
Well, I don't know whether he got the Republicans or not, but look, I'm confident he has a clear majority of the House and the Senate for reform. Because one of the things that struck me as a person who sat on the other side of that podium for 36 years as a United States Senator was, he really recentered his debate and said, hey guys, you like the way things are? No problem. Stick with it. But he implied, does anybody in here think we don't need massive reform of the insurance industry, massive reform of availability of health insurance out there, massive reform to bring down the cost of health insurance? And when posed with that kind of question, as we narrow down the time to vote on this, I think it's going to cause an awful lot of people to have an epiphany here.
I have to ask you about one of the startling moments last night when we hear coming out of the crowd, it was Congressman Joe Wilson of South Carolina, a heckle of the president. You lie, he shouted, and we watched your face in that moment, and you turned and talked to Speaker Nancy Pelosi. What did you say to her? What did you think about that moment?
I was embarrassed. I was embarrassed for a chamber and a Congress I love. I served there for 36 years, and I thought it demeaned the institution. And I thought it sent a signal to every young person out there that that was very, very damaging. But I know Joe. He apologized. I take him at his word that he got caught up in the emotion of the moment. But the fact is that the assertion the president made is absolutely true. It will not cover undocumented aliens.
Congressman Wilson called for the president. He talked to Rahm Emanuel. So word was sent out, apology accepted this morning?
Well, I haven't spoken to the president, but knowing the president, I'm sure he accepted the apology.
I want to turn, if I can, to the public option, because there was a sentence that the president used that some people think it's where everything's going to end up here. He's talked about the fact that some suggest that the public option be a kind of trigger that goes into effect if needed because the health insurance companies are not providing affordable policies. Will he accept that as the final provision in the bill, that it's a trigger mechanism to come later if needed?
Well, the president laid out what he wants. What he will, in fact, look to if people have better ideas as to how to accomplish. He laid out, and I wrote it down because I wanted to make sure that everybody understood it, and I said it precisely. He said the basic principle that if Americans can't afford coverage will be that we will provide a choice, an affordable choice. That's what the public option is, a guarantee that there'll be an affordable choice. If someone figures out another way to do that, whether it's a trigger or something else, and that's the view of the Congress, the president will look at that. But we still think what we laid out, what the president laid out of a public option, provides competition, gives people a guaranteed access to an affordable health care plan if, in fact, there's not one available. He pointed out, for example, in some states, Diane, there's very little competition.